Thank you everyone for joining us for the webinar today. I'd like to begin by acknowledging the traditional owners of the land in which we meet today. I would also like to pay my respects to elders past, present and emerging. If you don't know, my name is John Batty. I'm the president of the Asbestos and Hazardous Materials Consultants Association. I'm really pleased to be presenting this lead webinar to everyone today. This week marks International Women's Week. On that note, we're pleased to note that women make up approximately 25% of the association members. In a whole, women tend to make up approximately 40% of their industry. So I'd encourage all women out there who are part of the industry to come and join the AHCA as well. Bit of housekeeping to start off with. Please ensure that you remain muted on for the session. If you do have any questions, please utilise the group chat. We've got people watching that at the moment, and we'll raise any questions. We are running this as a webinar just because of COVID restrictions that are in place at the moment. I know they are starting to relax, and we're hoping in the future we can have more face-to-face sessions where we can have some good networking events as well. To start off with, before we get into the sessions that people have come to see, a bit of news around the AHCA and what's been happening of late. I'm sure people are aware we've just had our AGM, which wasn't that long ago, and we're pleased to introduce the new executive members of the AHCA. If you don't know, my name is John Batty. I'm the president. I have more than 15 years experience in asbestos and hazardous materials management, along with occupational hygiene and environmental consultancy. And I'm currently the managing director of EDP Consultants. As a founding member of the AHCA, I've recognised the need to have like-minded professionals come together to drive best practice in the industry and to ensure a consistent quality approach and managing hazardous materials at all levels. Leroy Brown is our vice president. Leroy is an occupational hygienist with over 15 years experience in the industry and is currently employed as a senior occupational hygienist for AHCA, managing the New South Wales region. Cassandra Fernandez has come on board as our secretary. Cassandra has 10 years experience within the hazardous materials industry and as a senior consultant is a senior consultant with Greencap. Cassandra has strong practical experience in project management, asbestos and hazardous materials surveys, and material risk assessments in a large variety of fields, including both friable and non-friable projects. Fraser Elder rejoins us as treasurer. Fraser is a state manager of EDP Consultants and possesses over 20 years experience in hazardous materials, occupational hygiene and environmental management, gained both in Australia and the United Kingdom. Chris Thomas is new to the association. Chris is an executive member. Chris is the managing director of EP Risk Management and a principal environmental scientist with over 20 years experience of international consulting experience in the areas of contaminated land management, risk assessment, asbestos in soil remediation, and occupational hygiene. Richard Wilkinson is one of our executive members. Richard is a national leader at Tetra Tech Coffees in the occupational hygiene space and is a NATO technical assessor in the field of chemical testing. Richard also sits on the NATO Accreditation Advisory Committee for asbestos and occupational hygiene. James Lowe, last but not least, James Lowe. James Lowe has joined us as an executive member. James is a project manager at Pure Contracting with over 15 years experience in the hazardous materials removal sector. So I'd like to welcome all of our new executive members to the executive member board. Just go through quickly what our roadmap is. So the executive committee met up only a couple of weeks ago as part of our first meeting, and we've drafted up a roadmap for 2021. This puts instead some key areas that we'd like to discuss moving forward. This starts with the lead webinar in March that we're having today, extends to April, where we're hoping to have a lead roundtable session with the regulators as well as our business members. We currently have a lead working group working on lead management risk assessments and a lead management framework. We're hoping that in July they will be able to present to the AHCA members. In addition, in July, we're hoping to have our Christmas in July party, so something to look forward to in July. August, we're aiming to have another lead roundtable session where we can discuss the intricacies of the lead management framework with the regulators and hoping to have some changes in the industry. In October and December, nothing has been planned as yet. However, we have placeholders for future events that may be occurring. So watch this space. Okay, so just a bit of news, and I won't bore you for too long. I'm not sure if people are aware, but the AHCA is a member of the Demolition and Asbestos Consultative Committee, with other members being Safe Work New South Wales EPA, Asbestos Safety and Eradication Agency, Asbestos Removal Contractors Association, and local government representatives. On the 17th of February this year, we had our meeting, and some of the take-home messages from that include the requirement for asbestosis and mesothelioma diagnosis to be provided by New South Wales Health to Safe Work New South Wales. So that comes into effect on the 1st of April 2021, and that's really to allow Safe Work to track the incidence of asbestosis and mesothelioma in the industry, so they can see where the major issues are. I'm not sure if anyone's aware, but licensing is moving electronic. So similar to what we've got with our driver's licenses, a lot of our other licensing will now go electronic, and that will be through the Services app. In the interim, or in the short term, the asbestos and demolition license holders, they're due to go live on the 1st of May 2021. Asbestos assessors are not included in that list of licenses to be transferred onto the system in the initial stages, but the news is that we will be on that list not very far into the future. And in the short term, by late March 2021, Safe Work New South Wales construction industry cards, also known as white cards, they are currently in the pilot stages, but the intention is for them to go live for everyone in March 2021. These electronic licenses will not replace the licenses or the hard copy licenses that we've got currently, but will be another avenue for us to keep our licenses with us. Safe Work New South Wales and some of the other bodies are currently working on asbestos awareness tradie style videos that will run for about 5 minutes in duration, and these will be finalised shortly and hoping to be published at the end of March. These will be available for us to review prior to them being published. They're not there to replace any asbestos awareness or requirements to have licensed individuals to do assessments or removal. What they are there to do is provide some additional awareness to people out there working in the industry, people doing demolition work, and people undertaking home renovation work. So I'd encourage everyone to review them and come back to Safe Work with any changes that they feel may be required. High pressure water blasting of asbestos roofs continues to be an issue, with major incidents in Bilgola and Willoughby of late. I'd encourage all of our members to share the Safe Work New South Wales high pressure water blasting video on their social media accounts. The AHCA has done that recently. Whatever we can do to raise awareness in the industry and in the community, I think we need to, because of the potential risk and the hazard associated with that activity. And then finally, I'm not sure if people are aware, but there's an asbestos.newsouthwales.gov.au website. The AHCA members have been integral in the development of that website, reviewing and updating the materials that were on that website. I'd encourage all of our members to review that website. If they note any discrepancies or any issues with that website, please raise it with one of the executive team so we can raise that with New South Wales EPA so that can be remedied moving into the future. Obviously, this is a site that a lot of the general public review, so we need that to be robust and the information to be accurate. So if anyone sees any issues, please raise them. All right, so onto the the lead webinar. So this lead webinar is the second in a series of events around lead, specifically lead paint and dust. The first session we had Andrew Farnos from the AOH and Abe Lau from Safe Work New South Wales. If anyone missed that session, I'd encourage you to log on to the AHCA website and view that presentation. That's available for anyone. I'd like to welcome our speakers, Dr. Julia Norris and Alan Lai, who have given up their time to share their knowledge with you today. To ensure a seamless presentation, we've got our executive members here in Leroy Brown, Fraser Elder, as well as Cassandra Fernandez, Richard Wilkinson and Chris Thomas, who will be taking your questions and vocalising them to our speakers today. So if you do have any questions, I'd encourage you to type them out on the chat, and we will share them with our presenters today. Firstly, I'd like to introduce Dr. Julia Norris. Dr. Julia Norris is an advocate of preventative health with a unique combination of qualifications and experience in both occupational hygiene and medicine. Julia is the Director of Occuhealth Proprietary Limited, an Australian occupational hygiene and health consulting company, which she founded over 20 years ago. She is a Fellow of the Royal Australian College of General Practitioners, a Certified Occupational Hygienist, a Fellow of the Australian Institute of Occupational Hygienists, and a past President of the AOH. Julia has over 25 years experience in occupational health matters and is also one of 3 current expert members on the Western Australian Commission for Occupational Safety and Health. Julia has been kind enough to offer her time to present to the AOH today, specifically around lead and the human body, exposure pathways and distribution and health impact. So welcome, Julia.
Hello, thank you very much for having me.
I'll stop sharing and I'll allow you to share.
How are we going? Am I sharing there yet?
Not as yet.
Okay, let me go back.
Button at the bottom that share screen.
Share screen, and then this one.
And then I think you just got to click share. There we go.
How's that?
Yep, we're on.
Is that slideshow?
We're just showing your presentation there with the slides on.
There we go.
Spot on.
Excellent. All right. Thank you very much for bearing with me for those technical difficulties, and thank you very much for the invitation to come and speak to you all today. So I am aware, and I've seen the lead presentation that you had last year, and I'm going to try not to be too repetitive in talking about what I'm talking around, and I won't focus too much on the occupational hygiene, but really more around lead and the human body, how we are exposed to lead, how lead affects our body, the health impacts, and just a very brief little bit of discussion around biological monitoring and blood lead levels. So I'd also like to talk a little bit about specific populations with lead and the health effects in specific populations, and also give you a little case study at the end, which just is a recent example of some work that we've done with lead and some of the issues that can arise. So I know that you're all very well aware of this, and this has probably been covered in a lot more detail elsewhere, but just to set the scene, obviously lead has been fairly widely used throughout the history of man, really. You know, going back to 2000 BC, lead was used in plumbing and creating, you know, receptacles for water and wine and those sorts of things. But more commonly today, we have used it in recent history in paint. You know, up until 2010, lead was still allowed to be an ingredient in paint and really wasn't completely banned in Australia until 2010, which is really quite recently. So there's a lot of historical lead around the place. It's used in electricals, welding, soldering, ceramic glazes, those sorts of things. And while we have you know, gradually been changing our regulations and restricting the use of lead, it is still mined, and it is obviously still very prevalent in our environment because of that historical use. And because of that, obviously one of the major sort of areas of exposure these days in the occupational setting is in demolition and waste handling. Certainly from a non-occupational perspective, lead-based paint is a major source. Interestingly, because of our fantastic use of the internet and the availability of things from all around the world these days, we do still see sometimes lead in imported cosmetics and herbal remedies. Less so these days in drinking water in Australia, but we do still come across it every now and again. And contamination from nearby industry is still, really can be a major source. And for anybody in Western Australia, you would probably remember the contamination of the Esperance township with lead concentrate from the port facility there only in the last few years. Lead sinker making, I know might sound like something that has, a thing of the past, but as recently as last year, I actually had a patient in general practice who had elevated blood lead levels from making homemade sinkers at home. So, lead is still out there, it's still widely used, and we do still come across it. It's a really important contaminant both in occupational and general environmental medicine. So how are we exposed to lead? As with all things in occupational hygiene and with exposures, the main routes of entry are the respiratory system, the gastrointestinal system, and the skin. In terms of lead, the respiratory tract is a major area of absorption, particularly when we have airborne lead. So if there's dusts or fumes in processes and we breathe in lead contaminated material, we absorb a lot of it. So the lungs have a surface area of around 70 metres squared, and they're designed to absorb things really quickly and really readily. It's a very fine membrane in the lungs, doesn't create a lot of resistance, and about 50% of the lead that we breathe in contaminated air will absorb into our bloodstream. So certainly for adults, the respiratory tract is a major pathway for exposure to lead. The gastrointestinal tract can be really significant where there's a risk of getting lead contamination into your mouth and into your gastrointestinal tract. So where there's issues around eating, drinking, smoking at work, non-separation of clean areas and dirty areas, and poor decontamination processes, there is a high risk of exposure through the gastrointestinal tract. Obviously, our gut is a bit more of provides a bit more resistance than what the fine membranes in the lungs do, but our gut is also designed to absorb essential elements and metals and nutrients. So when it's a really large surface area, and when we're in states of fasting, so we don't have anything else being absorbed in the gut and we have all of our transport mechanisms available to us, when we are deficient in certain elements like calcium, iron, phosphorus and zinc, our body is designed to preferentially absorb these sorts of nutrients or like nutrients, and often that can create an increased uptake of lead in the gastrointestinal tract. I've put in here children, just in brackets, they can absorb up to 50% of the lead that they ingest through the gastrointestinal tract, much higher than adults, and that's because of the development of the gastrointestinal tract and its immaturity. Traditionally, skin has not been thought of as a common route of exposure among adults, unless we're talking about organic lead, and probably the most common one traditionally would be lead-based fuels. But certainly if our skin is a really good barrier, and it's designed to be a barrier so it doesn't let things freely and easily into our bloodstream, but if we damage that barrier and its integrity, then we can certainly get enhanced absorption through the skin. And use of solvents and excessive cleaning products on the hands that really damage the integrity of our skin can certainly increase the amount of lead that we absorb in that way. So there's probably nothing new to you all there. Really, the focus on controls are around exposure through hand to mouth and ingestion and exposure through inhalation. But once that lead has entered our body and got into the bloodstream, majority of it attaches to our red blood cells, about 99% of it, and about 1% in the blood plasma. And that lead is then transported around our body. So when we're first exposed to lead, most of the lead is in our blood, but very quickly that lead is distributed to different areas of the body. And once that happens, less than 5% of our body burden of lead remains in the blood. The half-life of lead in the blood is around about a month, and that, just keep that in mind as we go down the track a little bit and start to talk about our case studies and that'll become a little bit more obvious. In children, lead stays in the blood for a lot longer, creating more complications. And as I said, I'll talk a little bit more specifically about children a little bit later in the presentation. So once it's in the blood and it's distributed to the body, where does it end up? So the majority of lead ends up in our bones. So about 90% of the lead that we absorb are deposited in our bones and our teeth. So with sort of ongoing exposure, 90% of the lead that we take in will end up in our bones and teeth. It accumulates in areas of sort of active calcification and high calcification, and I'm not sure how large this is on your screens, but you may be able to see here an X-ray of a child's bone, and you can see that the ends of the bone, the growth plates where all of the activity is occurring, it's really bright, and there's a lot of lead in that area of the bone. The half-life of lead in soft tissues is about 40 days, and the main soft tissues that are targeted or where lead is found in the body are the liver, kidneys and brain. And once again, that's really important when we get down to talking about the health effects and what happens when we're exposed to lead, because these are the main target organs that are affected. So the liver, kidneys and brain are really where the majority of those health effects are seen. So why is lead a problem? How does lead exert its toxic effects? It's predominantly through its ability to mimic or inhibit calcium. And that is probably 90% of it ends up in our bones. So within bone, lead's incorporated into the mineral structure of the bone in place of calcium. So it replaces calcium, and it's a way of the body dealing with lead in excess is to store it in our bones. But in terms of the effects that it has long-term and the disruption that it does to our bodily mechanisms, the other thing it does is that it mimics calcium. So calcium is really vital in a lot of our bodily processes, certainly in our enzyme activity and in our membrane transport activities. So calcium channels, active calcium transport are crucial for maintaining our homeostasis, and lead mimics calcium, so often it is used in place of calcium, and it disrupts those chemical processes in the body, disrupts our membrane transport and disrupts our enzymes, because although it mimics calcium and it's used in place of calcium, it doesn't have the same properties and it doesn't function as calcium. So its structure may be similar, but its function is very different, and therefore it impacts on our essential processes in the body. So trying to keep it pretty simple, calcium is vital in the body for building and maintaining strong bones and teeth. It's really important in our blood clotting. It's crucial in the way our nerves act, in sending and receiving signals through our neurological system, and also in our muscle contraction and relaxation. And the biggest, well, not the biggest, but certainly one of the most important muscles in the body is the human heart. And calcium is vital for maintaining correct sort of electrical impulses in the heart. It's also really important in producing and controlling our hormone levels. And so when we start to impact on our calcium homeostasis and we start to have other metals in the body that are mimicking calcium, then there's a lot of our essential sort of bodily processes that are impacted on when this occurs. So not surprisingly, when we come to the health effects that are caused by lead, and I know that you've touched on these briefly, but musculoskeletal is a really major one. So because the muscle contractions and because of the development of our bones are impacted on quite significantly by lead, then obviously we have a lot of musculoskeletal effects when you get really high blood lead levels. Neurologically, we can get acute effects like headache, difficulty in concentrating, irritability, confusion, and those sorts of things. Gastrointestinally, lead colic is the old-fashioned term, but a lot of abdominal pain, constipation, loss of appetite, and loss of function of the gut, really, from a gastrointestinal point of view. In general, we can end up with fatigue, sleep disturbances, and decreased libido, and they're really related to those hormonal impacts that lead can have in its inhibition of calcium. And then also hematological effects, which is related to lead impacting on our red blood cell formation and causing damage to our red blood cells. So anemia is a really common acute effect. But these all happen at really quite high blood lead levels, and these are blood lead levels that we probably don't get in industry and in Australia as commonly these days because of some of the controls that we have in place. But if you do get these very high blood lead levels, high exposures, then you can expect to have some really quite short-term effects from these exposures to lead. Generally under about 40 micrograms per deciliter of lead in the blood, you will get asymptomatic lead exposure, but that doesn't mean that there's not being adverse effects on the body. It just means they're not seen in the short term. And at those sorts of levels is when, and prolonged exposure to those sorts of levels are when we start to see the chronic health effects. So as we know, lead is, when we absorb lead, we distribute it out to the tissues because we don't particularly like to have a lot of lead in our blood. And so we store it. And over the long term, that starts to have significant chronic health effects. So cardiovascular disease and hypertension and high blood pressure are really common with chronic exposure to lead. Affects our blood vessel contraction and our blood pressure. Neurologically, this is probably one of the more common features that was noticed years and years ago, centuries ago in early lead workers, were these the confusion, lowering of IQ, psychiatric symptoms, and also sort of paralysis and peripheral nerve impacts. It does decrease the hearing acuity on its own, lead, but because of its impacts on your auditory nerve, but also it is an ototoxin and it can exaggerate the impacts of noise-induced hearing loss as well. Hematologically, I talked about before, anemia in both the short term and long term. Your kidneys are quite sensitive to lead, and it can certainly cause damage to the very fine membranes in your kidneys and cause nephropathy and damage. And also reproductively, for males, it can decrease your sperm count over the long term. So some pretty significant health effects that we really, it's really important that we understand, because it's important that people dealing with lead understand that there are impacts, and they need to understand the importance of the controls that are being put in place. So the other thing about lead is that because 90% of it is stored in our bones, you can actually continue to be exposed to lead or have elevated blood lead levels long after you're removed from lead work. So lead is released from our bones. Our bones form a reservoir of lead, and in times of accelerated bone turnover, our blood lead levels can rise even when we're not sort of externally exposed to lead. So if you had previously had a long-term exposure to lead and you had relatively elevated lead levels in your bones, and you developed hyperthyroidism or hyperparathyroidism, and you had a change in calcium sort of homeostasis, then you will, rather than releasing calcium from your bones, you will release lead and end up with elevated blood lead levels. If you had bone fractures, and I know Andrew touched on that briefly, then you can certainly get elevated blood lead levels. Prolonged immobilisation tends to have a very similar effect. Going through menopause and hormonal changes as you get older, and really quite importantly for us, and certainly looking at control of exposure in females, is that during pregnancy and breastfeeding, we also metabolise calcium from our bones to maintain our calcium homeostasis. And if we have been exposed to lead, then we will end up with elevated blood lead levels during pregnancy and breastfeeding. So your body works really hard to maintain calcium in homeostasis and to maintain very strict calcium levels in the blood, and it will pull calcium from places or push calcium into places to maintain that level. And in the case of lead, if lead is there instead of calcium, it will pull lead into the blood or push lead out of the blood in place of the calcium. So talking about children, and I've mentioned it a couple of times, but to get specifically onto the impacts of lead on children, young children under 6 years of age, or particularly under 3 years of age, are more susceptible to the toxic effects of lead because of A, their physiology, and B, their behaviours. So the blood-brain barrier, for want of a better term, can be considered a little more leaky or a little more active in its transport when we're younger. and certainly neonates and in the fetus, the blood-brain barrier is really quite permeable. So entry of any lead into the blood will result in elevated lead levels in the brain. And this is really important because obviously, you know, at this age, these neurological structures and systems are still developing. So we're not just damaging pre-existing nerves, we're actually preventing the development of new neural connections. Also in children, there's a greater prevalence of iron deficiency. So when you ingest iron, your body preferentially absorbs it if you're deficient in it. And so when you're iron deficient, if you ingest lead instead of iron, then you will preferentially absorb the lead in place of the iron, trying to deal with this iron deficiency. So the other thing with children is their behaviours. So as we know, kids put everything in their mouth. There's no sort of filter, there's no moderation, and particularly young children do develop by exploring the world through taste and putting things in their mouth. So they A, absorb more lead through their gastrointestinal system, and they B, put more things into their mouth, so they're much more at risk of exposure to lead and the adverse effects from it. You can see in this x-ray, there's a few little flecks down here in the bottom of the x-ray, which is actually little flecks of lead-based paint that a child has ingested. And some of the research suggests that even ingesting a piece of lead, a paint chip at about a 20-cent piece, can lead to a blood lead level in children in excess of 10 micrograms per decilitre. In the unborn child, as I said, and in neonates, lead does cross the placenta readily. So it does get into the bloodstream of your developing or unborn child really quite easily. And once again, it can get into the brain and affect your neurological development. Lead exposure during fetal development can occur through maternal blood if they are exposed to lead while they're pregnant, or if you've got a mother who was previously exposed to a lot of lead and has elevated lead levels in her bones, then obviously that can, during pregnancy, leach out the lead and elevate the blood lead level. You also do find lead in the breast milk of women who have got elevated blood lead levels. So around 3% of the blood lead level in a female is the level of lead in the breast milk. So once again, children absorb the lead really readily. If they're getting it in their breast milk, then that can really impact on the exposure to lead that they're receiving. So in children, as well as the acute health effects, you know, the target audience and target organs in children is much the same. You've got your nervous system, your blood system, your kidneys, gastrointestinal tract, and your hormonal systems. But in children and neonates, these are still developing. So the health effects are often long-term and can be, you know, irreversible if the exposures are really high in the developing child. So decreased IQ and cognitive levels, you know, encephalopathy and seizures at really high levels, peripheral neuropathy and impact on the development of sensory and motor nerves, hearing loss, anemia. These are all things that are irreversible if they occur in the developing child. Hematological deficiencies, anemia, you know, is probably something that it can be reversed, but nephropathy and lead damage to the kidneys is another sort of really significant impact that can't be reversed when it happens at such a young age and in the developmental stage. Once again, gastrointestinally, it causes colic, abdominal pain, constipation, and disorders of your endocrine system in terms of thyroid, parathyroid, and those sorts of disorders. So really, those two distinctions between children and the developing child and unborn child and the health effects in adults are really what guide our blood lead levels and our definitions of lead risk work in Australia. So you're all very well aware that we have different levels for females of reproductive capacity as opposed to all other workers. And that is not because females per se are more sensitive or at risk from lead exposure, but certainly any unborn or developing child or any neonate that worker is breastfeeding is certainly at very high risk of exposure to lead at really quite low levels. And that's really what dictates our definitions and our guidance in Australia and certainly around the world. So currently, or fairly recently, these levels have been reduced, and the current levels are 5 micrograms per decilitre for females and 20 micrograms per decilitre for all other workers. So any lead-based activities or work that is likely to cause a blood lead level of 5 micrograms per decilitre for females or 20 for all other workers is considered to be lead risk work. That's come down from 10 micrograms per decilitre for females and 30 for all other workers. So if you are managing a project or a workplace where there is a potential exposure to lead and you are likely to get more than 5 micrograms per decilitre for females, then this is considered lead risk work. And these levels are really quite low. It doesn't take a lot of exposure to get blood lead levels in these ranges. So what happens if you are in a lead risk work area? What do you need to do? You need to do regular blood lead levels, certainly before the worker commences work, to determine that there's no pre-existing elevated blood lead level and that they're safe for lead work. 1 month after starting in lead work, we repeat the blood lead levels to make sure that they're not increasing, and then at regular intervals thereafter, depending on what the blood lead level shows, we need to do biological monitoring or blood lead levels. Now, I just want to be really clear here and reiterate that doing biological monitoring and monitoring blood lead levels is not a control as such. It's a valuable tool to identify risk. It's a valuable tool to monitor the effectiveness of controls, and it's a really good educational tool and to improve controls and prevent further exposure. But monitoring people's blood lead levels on its own is not a control. It seems to be something that people focus on a lot, and it's really important, but just monitoring something doesn't actually reduce exposure, and it is not a control in itself. So currently, these are our guidelines. I'm sure you guys are familiar with these, and I won't read them all out to you. But I suppose one of the really key levels and guidelines here is when do we or when should we remove people from work, and when should we allow them to go back to lead risk work. So the level for removal from lead work is currently 30 micrograms per decilitre, which has come down from 50. And for women, it's actually less than 10 micrograms per decilitre, because anything above 10 micrograms per decilitre can cause significant irreversible health effects in unborn and young children. When we talk about return to lead work, we have to make sure that people have a low enough blood lead level that when they return to work, they're not going to immediately go back up over the removal from lead work criteria. But we also need to be satisfied that additional controls are in place and that you're not going to get ongoing exposure when you return to work. So return to lead work is not based purely on the blood lead levels. It's also based on reviewing what's going on at work and making sure that any potential exposures have been addressed and the risk of those have been reduced. So just as a quick demonstration to sort of highlight what we've been talking about there, I just wanted to share with you a project that we're involved in within the last couple of years, which was based on a restoration of an old building. So this building, historical building, was full of lead-based paint, and there was a project to remove all of the lead paint before the restoration could be completed. This was a chemical stripping project, and I was asked to oversee the biological monitoring program for this project. So they provided their lead management plan, and they reported that appropriate personal protective equipment would be used, impervious gloves, respiratory protection that was fit tested, disposable overalls. They had a plan for separating, break and rest areas from work areas, providing clean areas for eating, drinking, reported facilities for decontamination at the end of the shift, cleaning whenever leaving the work area. And they reported that they had trained all of their employees in lead and the hazards associated with lead and any precautions and controls in place to reduce their exposure to lead. So we started on the blood lead monitoring program, and at baseline, really the blood lead levels were negligible. None of them were currently working with lead. After 1 month of working with lead, the blood lead levels were all around 10 micrograms per decilitre. So you might be excused for saying, oh, well, you know, they're all around 10 milligrams per decilitre, so we'll just repeat their blood lead levels in 3 months. And while that's valid, what occurred to me was that actually in 1 month of working with lead, all of their blood lead levels had consistently gone up. And while they were not above any levels to withdraw them from work or anything like that, we really did need to speak to them about their control processes that were going on. So we looked at their workplace controls and we spoke to them about what they were doing. They felt like potentially there was some issues around the practices and the personal hygiene of the workers. So they did some more education and we repeated their blood lead levels in 3 months. When we repeated their blood lead levels, one of the workers had stayed pretty constant. One of the workers had gone up slightly, but one of them was actually really, had a really significant elevation of their blood lead levels. So according to our criteria, you know, this worker, MC, and so these were all male workers. So these were all the guidelines applied for the males. So this worker had a blood lead level of 28.3. And you may be excused for saying, well, his blood lead level is between 20 and 30, so we'll just monitor him again in 6 weeks. But the reality is, with that significant an increase in the blood lead level, we decided to remove him from the job. So clearly there was something that he was doing that the other workers were not, that was really impacting on his exposure to lead. And so we carried out a bit of an investigation as to what was going on. So he was removed from site when his blood lead level was 28.3, because while technically it's below 30, there was clearly an exposure there that was uncontrolled. And when we looked at it a little bit further, he had been fit tested for a half-face negative pressure respirator with appropriate cartridges before he started work. But once he'd been fit tested, he grew a full beard. So he was wearing a negative pressure respirator with a full beard, which obviously renders it pretty ineffective. He was also a smoker, and he did stop for breaks other than the scheduled sort of meal breaks. And there was some questionable hygiene activities about when he left the work area. And we think there was probably a significant amount of hand-to-mouth transfer of lead through that. And so really there was a process around re-education of this worker around being clean shaven, certainly while doing this lead risk work and wearing a negative pressure respirator, making sure that any breaks that he's taken, he undergoes the full decontamination and cleaning process when he leaves the lead risk area and going into those clean areas. And it took the opportunity to re-educate all of the workers to try and improve the, reduce the exposures and improve those blood lead levels. So given that we had removed him from work, we had to make a decision on when he was able to return to work. So essentially, the guidance says that when the blood lead level falls below 20 micrograms per decilitre, he's able to return to work. But remember, we also need to make sure that we've reviewed the controls and identified any sources of exposure and addressed these. So when we went through this process, we repeated his blood lead level at 2 weeks and at 4 weeks. And as I mentioned to you earlier, the half-life of lead in blood is around about a month. And that's pretty in keeping with what we saw. So after a month, his blood lead level had come down from 28 down to 17 without any further exposure. And we had obviously undergone that process of education, and we'd undergone a review of his PPE and his controls, and we deemed that he was fit to go back to work. Interestingly, as I said, we educated the rest of the workforce as well and went through and made some changes to the way the decontamination was occurring. And at 6 months, all of the blood lead levels were actually significantly lower than what they were after just 1 month. So really, I suppose the moral of the story here is sort of don't underestimate behaviour as a major contributor to exposure to lead and addressing those behaviours, but also that the biological monitoring and the blood lead levels can be a powerful educational tool when, really getting workers to engage in those control programs and limiting their exposures to lead. So while it's a really valuable tool, really good for enforcing controls, just remember that, the blood lead levels on their own, and measuring these are not a control. So I think that's pretty much, hopefully I've managed to keep pretty much to time. And I'm happy to take some questions.
So we'll open it to any questions. Feel free to type in any questions in the chat. While we wait for some questions to come through, I've got a couple that I wouldn't mind asking Julia. You talk about the half-life of the lead in blood being 1 month. The process behind the lead going out of the blood, is that it going into the bone, or is there some way that we excrete the lead in the body?
Oh, absolutely. So yeah, we definitely do excrete lead through the kidneys. That is, it's the major sort of source of elimination from the body is through the kidneys, but essentially your body will get rid of it any way it can. So your kidneys will process it as fast as they can, but you will push it into your soft tissues and your bones as at the same time to get it out of the bloodstream. So that process of elimination from the blood is a combination of excreting it through our kidneys and also pushing it into soft tissues and into bone.
Fantastic. And I think there's one that's come online. One from Nigel. Lead in blood testing is lag indicator. What could you do to be proactive in managing lead exposure, i.e. should air monitoring be undertaken?
Yeah, absolutely. So one of the issues is that air monitoring is obviously only monitors exposure through the respiratory pathway or exposure through the lungs, doesn't account for, so in the case of our particular sort of case study that we did, there wasn't really a lot of airborne exposure because it was solvent, paint scraping with solvents. There wasn't a lot of airborne lead generated. And what airborne contaminants were generated were theoretically taken out by the respirator, but it was the inefficiency of the respirator and the sort of activities that the people were doing that were really sort of impacting on their uptake of lead. So air monitoring can be valuable when the respiratory pathway is a major route of entry into the body, but air monitoring does only really measure your exposure through the lungs, and it doesn't take into account any exposure that you're getting through ingestion.
Okay, fantastic. You may have answered this question with the chemical stripper example. Was the exposure primarily through indirect contact? I can't imagine it would have been airborne.
Yep. Yes, correct.
Got another one.
Yep.
So with the current COVID situation and the increased use of hand sanitizer, is this increasing the risk of absorption through the skin?
Yeah, so obviously one of the major adverse effects or side effects of excessive hand sanitizer use or prolonged hand sanitizer use is dermatitis. So once dermatitis basically is where your skin is stripped of its fat, becomes a lot more permeable, and it doesn't is not as effective in preventing things getting in through the skin. So yeah, definitely if you're using same with excessive washing, so excessive washing of the hands, using hand sanitizer, anything that's going to impact on the integrity of your skin will increase your risk of absorption through the skin. There's been a few studies more recently that show that we do absorb a little bit of lead in through the skin. You used to sort of think that we really didn't absorb any, but it isn't a major route of entry unless you are dealing with organic lead or really, quite significant, prolonged exposures to the skin. It's more about getting it from the skin into your mouth is a more common route of entry.
Yep.
So do we have another one? Sorry, it's Fraser from EDP. Are there numbers of lead poisoning in kids? Are these still as high when the standards were originally developed, or are these decreasing?
Yeah, look, they definitely, I think there's, I can only speak from the Australian perspective. Certainly in Australia, there is, barring those inadvertent community exposures. So when you have a community exposed from a nearby facility and you get a lot of lead contamination of the general environment, we don't have as much of, we don't have as many children significantly impacted on by lead exposure with the lowering of the standards, and with the greater focus on females in the workplace as well. So we have a lot more focus on, you know, lead exposure in females than probably there was 50 years ago. But we also have a lot more women in the workplace. So it's a lot more, you know, it's really important that we do that.
Question about lead in dust. A lot of our members will go out and do assessments of lead in dust, primarily in ceiling spaces and in inaccessible areas. Have you done any studies, or are you aware of any studies where there's a direct correlation between lead in dust and exposures and blood lead level increases? I'm thinking around demolition primarily, where people are pulling down ceilings and, you know, they're full of lead dust potentially.
Yeah, absolutely. So if you're anywhere where there is lead contamination in dust, then there's the potential, if it's disturbed, for you to breathe it in, or if it's not disturbed and you're touching it, then there's a potential for you to ingest it inadvertently. And I think that the Esperance example with the, you know, community exposures to lead is a really good one, because that is exactly, there was lead, you know, contamination in the atmospheric dust in people's homes and in the environment. And the community blood lead levels in both adults and children's were, you know, significantly elevated. So definitely, if you're finding lead in the dust in ceiling spaces and that dust is disturbed, then you absolutely are at risk of increased blood lead levels through either breathing it in or through, you know, getting it from hand to mouth contamination.
Yeah, I guess, you know, typically we find it because of the car exhaust, and that settles in the ceiling spaces over time, and you get quite high levels there. And I guess the take-home message is, if it's not disturbed, it generally isn't a risk. However, if it is disturbed, it needs to be managed appropriately.
Yeah, definitely.
We just got another question on, would someone exposed to high lead in blood levels still suffer from health effects after a period of time when the lead in blood level have reduced to an acceptable level, assuming the lead has transferred to the bones or soft tissue? If so, is this considered as part of determining if the worker can return to lead risk work?
Okay, so that's a fairly long question, so I'll try and interpret the two parts of that. So essentially, when we're monitoring the level in the blood, and that is what our decision is based on. It's often not really possible to determine how much of that lead has been transitioned or incorporated into the bone or into the other soft tissues. You will so essentially, once it's in the bone, if you have normal homeostasis, then that's where it will stay. The issue is if you then develop some condition which prompts you to release calcium from your bones. So as I said, if you become calcium deficient or vitamin D deficient, then your kidneys are a major source of maintaining your calcium, and if they can't manage it, then they'll start to suck it out of your bones, essentially. And that's when you're going to get, you can actually go from a normal blood lead level to an elevated blood lead level without any exogenous exposure, just by resorbing it from your bones. But it's not something that we measure, and it's not something that would be, part of our decision making in terms of putting you back into the workplace, because we're really measuring what your current exposure is and monitoring that, because we really I don't know what you've been exposed to throughout the previous 40 years of your life or those sorts of things. Yeah.
Oh, fantastic. Any more questions? I think that's all the questions we've got at the moment. Thank you very much, Julia, for your time. We really do appreciate you presenting to us today and sharing your knowledge around lead exposure and the health implications associated with that. It's good to see that we're getting under control, and people are starting to take it seriously, especially when there's a bit of education involved as well, and that's really great. So thank you for that.
No problems. I'll just stop sharing my screen, shall I?
Sure. Yes.
Okay.
Let's share my screen now. All right. So I can see Ellen's there. I'd like to introduce Ellen Lyon. Ellen is a Senior Project Officer of the Resource Recovery Innovation Unit within the Environmental Solutions, Chemical, Land and Radiation branch of the EPA. Very long title, Ellen. He's part of a team that regulates the New South Wales waste classifications and resource recovery framework, and provides technical and legislative advice both internally and externally. With about 20 years of experience, Ellen also represents the EPA as an expert witness in court cases that involve the prosecution of waste crime, and has recently authored the addendum for PFAS in the waste classification guideline and the waste requirements in the site auditor guidelines. Ellen has been kind enough to speak to us today as the regulator, and is going to be speaking about lead paint and dust disposal requirements, details of processing of lead paint waste, and the challenges associated with demolition waste found to contain lead paint and dust. And I'll pass over to you, Ellen.
Thanks, John. Can people hear me okay with the sound?
Yeah, it's perfect.
Yep, excellent. Okay, I might just share my screen. Okay, I've just got a message that's popped up that says host disabled participant screen sharing.
Let me just, I will update that. Should be right to go now.
Excellent. Okay, give me 1 second.
Yep, we're on.
Excellent. All right, so yeah, thank you for having me here today. It's great to talk about lead paint and waste. We value the association's feedback and comments to the waste classification framework, and yeah, we look forward to working with the association just regarding any improvements that we can make to this framework, just to make it better. To give you a bit of an overview of today's presentation, so the association essentially sent about 15 questions to the EPA to respond to in relation to waste classification of lead paint and waste. Those questions include, for example, how do you classify lead paint waste? How do you dispose of it? When it goes to a facility, what happens at that stage? So I'll go through those 15 questions that the association has put forward to the EPA. I'll also provide some practical examples that explain the classification framework. I'll talk about some industry practices the EPA does not allow. And I'll also talk about some improvements to the waste classification framework. All right, so the first question that the association asked of the EPA was this: what is a definition of lead paint waste? That is, what is considered lead paint percent weight by weight, paint on its own, paint fixed to materials, or dust? So I'll talk about the hazardous waste pre-classification first.
Sorry to interrupt, Alan. Not sure if you're sharing the right screen. You're still on the front cover.
Oh, okay. Hang on a second. Let me try again. Did anything pop up there?
That's perfect. That's the one.
Okay, I might just skip to the next page and see if anything pops up.
May include, yes.
Yep, okay.
Great.
All right, so I'll talk about the hazardous waste classification first. You'll find this definition in page 3 to step 3 of the waste classification guidelines. And essentially it says lead paint waste arising otherwise than from residential premises or educational or childcare institutions. So in terms of the things that it may capture from this definition, it could include lead paint attached to building materials, lead paint in waste, and lead paint dust. And so for this definition, there are no thresholds. And I'll talk about why later on. I'll talk about why that is the case and why we don't have thresholds that relate to the definitions in the waste classification guidelines. But for the first slide and the second slide, I'll just talk about what it captures. So in terms of the general solid waste pre-classification definition, again, you can find this in the waste guideline. It says waste contaminated with lead, including lead paint waste from residential premises or educational or childcare institutions. And very similar to the hazardous waste definition, it can include all those materials that I've just mentioned, but I've also added point 4 and point 5, lead in soil or excavated materials and any waste contaminated with lead. So for example, if you've got paper and cardboard, which is pre-classified as general solid, if it contains high levels of lead in that paper or cardboard, it's still pre-classified as general solid waste. And again, I'll talk about why in the slides coming. And similar to the pre-classification of a hazardous waste, there are no thresholds as well. So what I want to do now is provide some really practical examples that you may come across in your work. But before I continue, I just want to ask the question, can you guys see the slide that's popped up?
Yep.
Yep, excellent, fantastic, all right. So scenario 1, lead testing in soil on a site shows high levels of lead exceeding the hazardous waste classification. What is the classification? The answer to this question is that it really depends. It really depends on where it comes from. If it's from a residential site or a childcare institution or educational premises, it's pre-classified as general solid. But if it comes from a non-residential site, for example, commercial industrial, then it's pre-classified as hazardous waste. All right, scenario 2, concrete and timber. Waste that contains lead paint from an industrial site. What is the classification? So this one's quite straightforward. It's pre-classified as hazardous waste if the lead paint remains on the building materials. Scenario 2B, lead paint removed from concrete and timber waste. What is the classification? The answer to that is the paint itself. Once you strip that paint off from the concrete and timber, it will be pre-classified as hazardous waste, but the concrete and timber can be pre-classified as B&D, which is building and demolition waste, which is pre-classified as general solid. Scenario 3, lead testing on fill on a residential site shows high levels of lead exceeding the hazardous waste classification. What is the classification? Although it exceeds the hazardous waste classification, again, going back to page 4 of the definition of the pre-classified waste stream for general solid waste, because it's pre-classified, it's actually general solid waste. All right, I've got a few more examples or scenarios that relate to some of these definitions. Scenario 4, a residential site has lead and cadmium concentrations exceeding the hazardous waste classification. What is the classification? In relation to lead only, it would be pre-classified as general solid, but in relation to cadmium, it would be classified as hazardous waste. And so therefore, based on the guideline, you would manage it with respect to its highest class of waste. So in this case, because cadmium is classified as hazardous, you manage it as hazardous waste. This example, I think, is important because we've had instances in the past whereby waste generators and some practitioners have put forward arguments to the EPA whereby they do have hazardous waste and it could be related to a range of chemicals, but then they sprinkle a little bit of paint flakes on it and then try to classify it as general solid waste. So our guideline, I think, is quite clear about that. You manage it with respect to its highest classification. And so if you have other chemicals in it, then and those other chemicals classify as hazardous, then you manage it as hazardous. Okay, scenario 5, building from industrial site with lead paint is demolished for disposal. What is the classification? Short answer to that is hazardous if you choose not to remove the lead paint, and I'll talk about why that is important to do in the next few slides. Last scenario, scenario 6, metal structures containing lead paint from a commercial site are removed for disposal. What is the classification? This one is interesting in that it's simply classified as scrap metal and can be taken to any scrap metal yard so long they're licensed to receive scrap metal. So although technically it could be hazardous waste, because licensed facilities or licensed scrap metal facilities are actually licensed to receive scrap metal, there are controls in place at those facilities that manage those, I guess, risks associated with lead and other chemicals as well. And typically and generally speaking, those scrap metals are essentially recycled or smelted back into metal again. And those facilities have, I guess, those controls in place to manage pollution, etc. I can see there may be some questions that have popped up in the chat. I might just finish the presentation first, if that's okay, and maybe take questions towards the end of the presentation. So if you've got more questions, please note them, write them into the chat, and I'll try and answer them towards the end. All right, I just want to add, in 2018, we had a lot of representatives from the industry inquire about whether or not, in response to the pre-classification definition for hazardous waste, whether or not they could actually do lead testing of the paint itself to determine whether or not it was actually hazardous waste. So in 2018, we issued a number of, I guess, advice to industry, including practitioners, and that is the EPA has allowed testing of lead paint on non-residential premises, example, commercial industrial sites, to determine its total and leachable concentration for comparison against relevant total and leachable concentration values in the guidelines. So for example, if lead paint found on a commercial site would otherwise be pre-classified as hazardous, if testing shows that it complies with general solid or restricted, then it may be disposed of as general solid or restricted. Okay, question 2 from the association. Why is there a distinction between residential, educational, childcare facilities and other sites around classification of lead paint? So yeah, in summary, why is there a difference between some of these definitions between these two waste streams? So I'll talk about hazardous waste first. The policy in relation to hazardous waste targets essentially high concentrations of lead paint. Now, from our research and from our data, our data seems to indicate that for a typical commercial industrial site, the total concentration for lead is around about 15% as an average, and it can range all the way up to 60%. Now, if you look at the lead total concentration value for restricted solid waste, it's 0.6%. So 6,000 milligrams per kilogram. If you exceed that number in the waste classification guideline, you are automatically hazardous waste. And so because of that data, because of the research that the EPA had done in the past, we can confidently say that typically lead paint that comes from, or lead in lead paint that comes from a commercial industrial premises would actually be classified or pre-classified as hazardous waste. The quantity is considered large when compared to general solid, and these premises have or must comply with OHS legislation and are able to properly immobilise and remediate lead paint. Now, when it comes to general solid waste, the policy targets white lead paint or lead carbonate, typically. The quantity is considered small. And if you look at the concentration for general solid waste in Table 2 of the guideline, the total concentration value for lead is 0.15%. So again, if you exceed 0.15%, you're restricted. And because of the data that we have in the past, when we developed these definitions, typically from a residential site, it's likely to meet general solid waste. Now, I just want to acknowledge that we have come across sites in the past where concentrations of lead paint have exceeded the general solid waste criteria, but the frequency of occurrence based on the current data that we have is somewhat low, whereas the bulk of the lead paint concentration we're finding around that 0.1%, give or take. And so when this definition was developed in the late 1990s, the EPA met with WorkCover at the time, New South Wales Health, and a number of councils such as Department of Planning, and it was agreed as a whole of government approach, the best thing to do at that time was to classify it and quickly dispose to landfill. It was also agreed at the time by the government that grit blasting, immobilisation, remediation of these sensitive sites may actually increase the risk of harm to occupants. Hence why we have those two very different and separate definitions. Okay, question 3 from the association. Which categorisation of the lead-containing paint does the EPA endorse? WHS Regulation 2017 or Australian Standard? And the short answer to that is it is outside the scope of the EPA. The EPA does not endorse any of these regulations or standards. The classification in the waste classification guidelines are irrespective of concentrations. Now, you may be wondering, well, what do the numbers actually represent and protect in the waste classification guidelines? I've mentioned Table 1, Table 2 in the guideline, where there are some numbers for lead and there are some numbers for a range of chemicals. So one of the questions that you may be thinking is, well, what is the purpose of the waste classification guideline, and what does it protect if it doesn't endorse or approve the Work Health Safety Regulation or the Australian Standard? So I want to explain that and respond to that question through this diagram that I've put together. Typically, when waste goes to a landfill, what we're most concerned about is the leachate that will be generated eventually in terms of contaminants leaching off the waste. Now, when that leachate is generated, our concern is that it may impact groundwater and surface water. I've put in brackets may, because we do acknowledge that a landfill generally has a range of environmental controls in place to manage that leachate. There are landfills that have appropriate liners. They're engineered in such a way that they can actually manage that leachate capture management systems, etc. But in the off chance that that leachate is not managed properly, or it actually escapes that landfill, what we're most concerned about is the impacts to groundwater and surface water, because that in turn can impact human health through drinking water, agricultural use, recreational use, and eventually the aquatic environment. So what you see in Table 1 and Table 2 of the guideline in relation to those numbers for lead and for other chemicals, those numbers have been developed and derived in such a way that if you meet them, they are protective of human health and the environment in relation to groundwater and surface water impacts. Okay, question 4 to 6 and 5. Requirements for disposal of lead paint, including construction and demolition waste containing lead paint from non-residential sites. How lead paint waste is processed at the waste facility. Now, if it's general solid waste or pre-classified as general solid, any facility licensed to receive and dispose of general solid waste are able to take that waste. And I thought I mentioned there are no hazardous waste disposal facilities in New South Wales. Now, if your waste is hazardous, the lead paint can be taken to hazardous waste processing facilities such as Cleanaway. I think they have about 2 or 3 facilities in New South Wales that can do that. The lead paint itself can be taken to a secondary lead smelting facility such as Energy Power Storage Recycling Proprietary Limited in Wagga. The last time that I spoke to this company, they were only taking really high levels and really concentrated levels of lead paint in order to make it economical for them to smelt and process. Another option would be to immobilise on site via an immobilisation approval from the EPA. That would then allow you to reclassify that waste as general solid or restricted. But typically that process involves mixing it with, say for example, lime, some concrete, and then testing it to show that it's not leachable. That then allows you to reclassify it. Interstate may be an option. And if you choose not to remove lead paint, then building materials are classified as hazardous, and therefore interstate disposal may be your only option. And the EPA recommends removing lead paint first with the paint removal agent or grip blasting from building materials. The paint itself removed can therefore be classified as hazardous waste, taken to Cleanaway, taken to a secondary smelting site or immobilised, and then the building materials can be classified as general solid. All right, so I just want to talk about why it's important to remove lead paint from building materials. Typically, where you have building materials that contain lead paint, one of the pathways for this material is to end up in a waste recycling facility. And if it's still attached to the building materials, and as you may know, these materials are recycled and they're processed, they're crushed, they're sieved, etc., to meet a certain specification for land application purposes. So from a waste recycling facility, they can make recovered aggregate. That aggregate can go back onto any site, essentially in New South Wales. They can make recovered fines or processed soil, and again, that could be land applied on any site, back onto a residential childcare facility, a school, etc. And the same equipment they use to make ag and fines is the same equipment they use to recycle other waste streams as well. So again, if lead paint is not removed from these building materials, our concern is that it may end up back in the environment and end up back into the community. The second pathway for building and demolition waste that may contain lead paint that's not removed ends up in a disposal facility or a landfill. And as I mentioned before, at those hazardous waste concentrations, it can actually contaminate groundwater and surface water at levels that may impact the aquatic environment, drinking water, recreational use, and agricultural use. So again, if lead paint is not removed, what that does in terms of a concern that we have, it may increase the risk to human health and the environment. I just want to make mention in relation to recovered fines, processed soils, and recovered aggregate, the waste recycling industry probably make about over 1 million tonnes of this material. And again, you can imagine if lead paint is not removed properly and it's still on it and it's been recycled, then we're talking about potentially over 1 million tonnes of this material containing hazardous levels of lead paint being put back in the environment. Okay, question 7 to 9 and question 15, clarification about lead dust and how to classify. The classification for dust is exactly the same as lead paint, based on part 1 of the guidelines. So if you've got lead dust from a residential site, it's automatically pre-classified general solid. From a non-residential site, it's automatically pre-classified as hazardous, and those disposal requirements are the same for lead paint. Now, the only exception is this general immobilisation approval called the Pasminco naturally immobilised waste, which you can find on our website. Under this immobilisation approval, dust, soil containing dust can be classified as general solid waste. The only thing you've got to ensure that you meet is the waste needs to come from the Pasminco lead abatement strategy area at Cockle Creek. And so if you look up the GIA, the General Immobilisation Approval from our website, there's a map towards the end of that approval that shows you the area that this immobilisation approval captures. So if you're in that area, or if your site is in that area, then any dust, soil or soil containing dust is classified as general solid. Okay, number 10, what happens with lead waste if it is from a residential property that has been reclassed as commercial? Short answer to that, it really depends on the issue. I'd say contact the EPA. We can be quite pragmatic about that. Question 11, provide examples of storage methods for lead dust and paint for transportation to a waste facility after remediation. Waste in general must be stored in an environmentally safe manner according to clause 112 to the waste reg. The waste regulations don't have anything specific to lead, but it's got this clause that captures waste in general. And so the EPA considers environmentally safe manner as not causing or unlikely to cause a pollution incident. So for example, if you've got bags of dust or lead dust, then those bags should be sealed to minimise or prevent a pollution incident. And waste tracking may be required under the waste reg in Schedule 1 in Part 1, 2 and 3. And you may need to contact Safe Work and follow appropriate codes of practices and standards in relation to transportation and storage. Okay, question 12. When lead, dust or paint are removed by suck truck, how do you classify? Can we use the NIPM criteria? It's the same classification process that I've just mentioned in the waste guideline. And short answer to this question is no, you cannot use the NIPM criteria. Question 13, ACT does not have a hazardous waste pre-classification. What is the EPA position about transportation and disposal between ACT and New South Wales borders? Our guidelines only relate to New South Wales only. So I would suggest seeking advice from that jurisdiction, from ACT, about transporting waste from New South Wales into their jurisdiction. You may need to comply with their requirements, and you may need to track the waste through our website. Okay, question 14. With removal from the previous Australian standard of dust clearance inspection standards, what does the EPA deem as the preferred standard to be adopted? This question is unfortunately outside the scope of the EPA to advise about clearance inspection standards. The EPA does not regulate these things. This may be a safe work matter. And in terms of what we regulate in the context of waste regulation, it's to ensure that waste is classified appropriately, taken to a lawful disposal or recycling facility, and that the recycled materials are lawfully reused. Okay, 2 more slides. Industry practices that the EPA does not allow, and there's 3 of them that I'd like to talk about. Averaging the lead concentration across the mass of the waste. So for example, if you've got, say, 1% lead in paint, but if you've got, say, a very large quantity of waste, 100 tons or 1,000 tons, what we're seeing in some circumstances, practitioners dividing that concentration by the weight of the waste. And by doing that, they are essentially lowering the concentration of the lead, and therefore trying to classify it as, say, for example, general solid as opposed to hazardous. And again, this is a practice that the EPA does not allow. It actually triggers section 144 for AA, providing information about waste that's false and misleading. There are heavy penalties. The difference between part 1 and part 2. Part 2 is knowingly supplying false and misleading information. And I've just put together some maximum penalties there. Another practice that we are aware of, people bypassing the hazardous waste classification and then using the general solid waste classification. So in other words, waste generators bypass that definition. They go straight to B and D pre-classification as GSW. So for example, they knock down the building and then call it general solid waste and ignore the lead paint that's on it. Again, it triggers some of these offences, and for the transporter or the generator, it triggers section 143, which is the unlawful transport and deposit of waste. And finally, one other one is the misuse of the EPA 2018 advice. What we're concerned about is people misusing the advice that we provided in 2018. So in 2018, the EPA provided some advice to industry to say, hey, if you want to test lead paint, that is completely okay, to demonstrate that the lead paint that you may have on that building material may not actually be hazardous waste. But we do have some information to suggest that people are knocking down the building, taking a sample of the building material, say the brick or the concrete, and by doing that, the hope is that they'll miss the lead paint in that sample. So that's something that a practice that we don't support and allow as well. Same as above, it triggers some of these offences. Okay, improvements to the waste classification framework. We do recognise that the framework could do with some improvements. We do acknowledge that the general solid waste pre-classification was only designed for the purposes of disposal, but we're aware that waste being pre-classified are actually, and some of it are actually ending up in recycling facilities. So we'd love to hear from the association and others around what we can do to respond to this issue. The other thing that we'd like to do is to review and refine the definitions. These definitions were developed in the late 1990s. We're now in 2021, and so does industry have data about lead paint in both residential and commercial industrial sites, that we can use that data to further refine those definitions. Another one that we'd like to do is make it clearer in terms of those definitions. We've had some representations from people from within the industry saying that, hey, if I don't knock down my building, it's not lead paint waste. So I can bypass the pre-classified hazardous waste classification, and then when I knock down my building, even though it has lead paint in it, it's now, I consider that now to be waste. So therefore, it's B and D waste instead, classified as general solid as opposed to hazardous. Again, that's not the position of the EPA, but if the definitions are not clear, we'd love to hear from you about how we can make it clearer. All right, so that's it. if you have any questions at all, feel free to call Environment Line. They can put your call through to our team. You can email us. There's an email address there. And if you want to subscribe to us regarding updates to our regulations, guidelines, etc., there's a website there for you to subscribe to.
Fantastic. Thank you very much for that, Alan. I saw there was a fair few messages coming up in the chat, so I think it's a major subject that people are quite curious about. So I might go straight into those questions if you don't mind. The first one is from Lee. Is there a possibility for the AHCA to review the data the EPA has utilised to make the determination between lead percent in paint in commercial versus residential? I think that was around you discussing that there was a higher level of lead in paint typically used in a commercial or industrial setting versus a residential setting.
If you've got data to suggest that it's at a lower concentration, say for example in a residential site, or a lower concentration at a commercial industrial site, we'd be more than happy to have a look at that data. The data that we do have comes from some recent, I guess, projects that I guess practitioners, waste generators have been a part of. The Sydney Metro, for example, is one of them. There's a lot of development works in relation to some of the roads where they've had to knock down some homes, etc. So our data comes from those sort of projects. But again, if the data that we have needs refining, and the data that we have is, maybe it needs to be refreshed because we're now in 2021, then yeah, we'd love to hear from the association if you've got any data to share.
I'll carry on. A question from Julie. I understand that the EPA is focused on environmental protection, but am concerned that the exemption for residential property gives a very mixed message. If the concern is leachate, then should they at least do TCLP testing on the demo waste?
Yeah, that's a really good question. I think it's at a point now where we can review the classification definitions, and there are some examples whereby we're aware of in some suburbs there's a lot of slag fill that are actually quite leachable. And again, the policy back in the 1990s, the late 1990s, was to target really lead paint waste. And lead paint that people typically poured into their soil in their backyards back in the day wasn't really meant to capture slag fill, for example, or really highly contaminated fill that would otherwise pre-classify as hazardous waste. So yes, I think it's a very good question, and that's something that we want to, I guess, fix going forward.
I think there was a follow-on question around that. There is concern that workers at the metal waste facilities who may generate dust or grind materials into mulch, exposing their workers and end users, i.e. mulch in vegetable gardens and so on and so forth. I think we'll probably take that as a comment. So I guess one of the questions we've got is around the removal of lead paint and the risk associated with the removal of lead paint, where you've got workers who are going in there and potentially blasting or chemical stripping, where they're exposed to potentially high levels of lead during that exercise, dust, vibration, noise. Does it outweigh the risk to the environment, and how can we manage that risk to human health, to the workers doing that work versus what the end outcome is?
Just trying to remember the question.
Okay. I guess it's just around, there's significant risk associated with lead paint removal. And if the EPA stance is remove the lead paint prior to the demolition of the structure and disposal of the structure, are we then exposing people to lead and other exposure, occupational exposures that they wouldn't have been exposed to previously? Are we not best to take that demolition waste and dispose of it as a different way, and reducing the risk to the work area?
Yeah, I think that's a really good question. I'd be interested to see whether, if the association has some data in this space, if indeed, stripping the lead paint from the building materials are actually an issue, and that presents a really significant issue to those workers, then maybe we need to consider, as suggested, the disposal of that material, and that material shouldn't be recycled at all. I think we've got to weigh that up with also the what the generators of that waste want to do with that waste. So because if for example, taking that waste to a disposal facility is more costly, containing lead paint in it, then I just wonder whether it would be good to get in contact with the waste generators as well, to see whether or not it's economical to do one option or over the other option.
Okay.
I might make a comment there. Hi everyone, I'm Helen Prifty. I'm a late addition to the presentation, but I've heard Alan present, so I'm all okay. I'm also from the EPA. For those who don't know me, I'm currently sitting in job sharing and director environmental solutions in chemicals, land and radiation. I think probably just to add to Alan's point is that the issue of removing lead paint is we would see is on par with any other occupational hazard that needs to be looked at by the demolition workers, and Safe Work does have some guidance around that. I'd have to find the right document around how to make sure that the lead is safely removed, and there are experts that do that in certain techniques. So we'd want to make sure that, we're definitely not having perverse human health outcomes by removing the lead paste, but it is something that has been occurring for a long time, and there are guidance on how to actually do that and ensure you're protected from a occupational health and safety perspective. But if people feel that there's some further work to be done in that space, lead is a human health and environmental contaminant, and we'd happy to encourage changes in that space. We can't really regulate in that area, but we can definitely work with Safe Work, and we do often, to ensure that we're able to safely recover resources where possible, and we're not putting the community or workers in harm's way to do the recycling, and that's the same as asbestos and other things as well.
Thanks, Helen.
Yeah, that's okay.
Probably a follow-on around that. One of the questions that came through is, couldn't we make lead paint similar to asbestos around a special waste lead paint, where it would stop the reuse of these materials such as bricks and concretes, and getting them back into the community around the recycling stream? Is there evidence that the leachate systems of waste facilities are not sufficient to recover lead leachate as well?
I think that's a really good question as well. That is something that we have considered, and I think we should continue to consider as to whether or not it can be given a special classification, kind of like asbestos waste and clinical waste. That's something that, I think we need to do some more thinking around and see how that impacts in terms of the waste recycling industry in terms of that classification. So yes, that's something that we can consider.
Yeah, I guess it's about what the behaviour change is necessary, and whether or not calling it hazardous or special is enough, or whether we put parameters around how it's managed, and what is the behaviour that we're trying to solve for and change probably is what we need to consider before. Because again, having a hazardous waste category is pretty serious, I think. So unless we do separate regulation potentially, we need to really think about that.
I guess the issues around the processing of hazardous waste, and if you've got paint on a timber door, for instance, are you processing that paint, or are you just disposing it in a facility that will accept that? I think that's the real challenge is. Any questions from the room?
Yep, there's one more come up. There's one more from two more just come through.
Okay.
All right, Prenza in Melbourne. It appears the EPA does not have a stance on lead paint clearances, stroke remediation, but allows waste to be classified as general solid waste on the assumption this process has been undertaken. Wouldn't the EPA want a more robust assurance or input into what is required to ensure the paint has been removed completely from the substrate material? If not, what guidance should be followed to ensure this process is uniformed across the industry?
I think that's a really good question as well. I think if this is an issue worth considering, we should work with SafeWork. If SafeWork is indeed the appropriate regulatory authority in this space, to work with them around, well, what would be the minimum standard in terms of removing lead paint, and how do you demonstrate that? So I do acknowledge that the classification framework is just based purely on the classification side of things, and it may be a good conversation to have with SafeWork to nut out maybe a process, a strategy around, well, how do we demonstrate, or how does industry demonstrate that it's actually being cleared properly?
Yeah, absolutely. I think the main challenge is if you go to remove lead paint from a surface, the chances are there's going to be residues there. And is the EPA happy for that material then to go for recycling, seeing that there is residues there, but the bulk has been removed? You know, where do we stand in relation to that?
Yeah, that's a good point, because I guess it depends on whether or not the people doing the work then assess how much lead is left and whether that would meet the current classification guidelines for reuse, or whether they're just assuming a minimum standard renders it suitable once they've done a certain process. As Alan said, we'd probably need to look at the process used to strip it back and whether that's leaving any residues that are sufficient enough to change its classification. Yep.
Okay, fantastic. I've got a message here from Ross. Does the EPA have any plans of raising awareness of lead paint and potential incorrect pre-classifications of construction demolition waste with demolition contractors as well as consultants?
I know we've got specific plans for it at this point, but if we think it's necessary, we can do it anytime. We have sent a number of years ago, we had a large amount of infrastructure projects popping out around the state. They're still continuing, but I think we did quite a lot of work with those contractors and have put out messages on various forums. There is information on our website on lead paint and safely removing it and handling it, but more for domestic uses. But if people feel that further education, or there's a issue with people not managing it properly, we could definitely put out some further information and communications through our stakeholder engagement area.
Yep.
Yeah.
Okay, fantastic. Question from Julie. How is your enforcement, and do you do spot inspections or visits around, I guess, lead management and disposal?
Not, I think, I don't know, Alan, but we wouldn't probably do, I don't know that we do construction sites in terms of looking at how those processes occur. We'd probably have to refer that to operations area, but definitely the recycling facilities that receive the material, there's definitely, spot checks of the material coming in and looking at concentrations there and the source of the material and whether they've considered the lead. And we've had some issues with people finding high concentrations at recycling facilities, but not too many. I think they're quite conservative there.
Yep.
Yeah, generally it's from the recycling facilities end, or it could be from a waste classification report. If something is appears misleading or false, those reports are sometimes sent to our mailbox or the operations mailbox, and that triggers us to follow up on it. The site audit scheme is a good scheme whereby we've put the auditors on notice to notify the EPA of any discrepancies in relation to waste classification reports. And again, that triggers the EPA to do something about it. But I think it's a good question because we'd like to be able to partner with, say, for example, Department of Planning or councils in relation to ensuring that at the generation site, it's done properly. It's classified properly before it goes to a recycling facility, for example. So I think that's a really good question.
We've got one final question. Can lead paint be sent to a laboratory for chemical analysis and TCLP while still attached to the material instead of immobilizing the waste on site after removal? Example, mixing with concrete. This would reduce on-site worker lead dust exposure and generally generate the same outcome as the immobilization of the waste after removal.
I think that's a really good question. Yeah, I think that's a really good question. I think anything is possible if you do have, say, some building materials that contain some lead paint in it. It's been demolished, broken bits of glass and bricks and ceramics and tiles, and it's got lead paint in it. I think it would be a candidate for immobilization approval, actually. And I think if you can demonstrate that you can immobilize it, generally we require some mixing of that material with, say, a concrete, a specification, or if it's just lead paint, some lime. If you can show that it's not leachable in terms of TCLP testing, but we also require the MEP testing, which simulate the leaching. It's a test that simulates the leaching of the contaminant in a landfill over 1,000 years. If that shows that it's not leachable or it leaches marginally, then yes, I think it would be a candidate for immobilization. Good question.
There are guidelines on our website as well for how to actually. The only issue with doing that is that you need to make an application to the EPA for an approval if it was on a case-by-case basis. So you need to consider if there was any time pressures, which there often is. I don't know to tell you guys about on construction jobs. So unless we try and encourage people to look at those in advance. If they do a building inspection and find it and they want to pursue that, they need to ensure that there's enough lead time to, get an approval and consider that with the EPA, and then where it's going to go after that.
I think that's all the questions we've got at the moment. Thank you very much, Ellen, and thank you, Helen, for joining in at the end as well. That's very much appreciated. I'd like to thank all of our speakers today. It was very informative. For anyone who came in late, we have recorded this session and we will be sharing it on our website when our website is fully functioning again. Just give us a couple of weeks. And they'll be up. Finally, just one more thing to share. I guess around the issues we've just discussed today, I think a great avenue for us to discuss those moving forward is around a lead roundtable session. So we'd like to invite the EPA and Safe Work to be involved in that session, and that's where we will invite representative of each of the business members to come and discuss these major issues. And obviously the regulations haven't changed since 1990, and we've identified major issues today and big questions that have come about. So if we can, I guess, the AHCA do their part in sharing our knowledge with the regulators and getting that forward, that would be great. So following this session, we will be accepting expressions of interest from business member representatives to be part of the lead roundtable. Ultimately, our intention is to discuss some of these issues that have come forward. So Ellen and Helen, if you're available, we'd love your attendance to that session. And we're planning to have that in April, and hopefully we can all come together and have a proper session in person. Okay, so that's the end of our session today. Thank you again, Ellen, Julia, and Helen for presenting today and answering our questions. Thank you for everyone online for your questions. I hope you found it very informative. We will be sharing this in the future. In the interim, if you do have any questions for our speakers today, they have their details were on their presentation. please also share them with the executive members, and we're happy to pass them on. Thank you again. Enjoy the rest of your afternoon, and appreciate all your time today. Thank you.